Okay, so I need to okay. Good morning and good afternoon, good evening, depending on where you are. This is a presentation. My name is Christopher Drake, and this is going to be a presentation about the Buteyko method. I've had the privilege to have taught the Buteyko method to around just over 20,000 people over the last 20 years, since around 1991. The Buteyko method is named after a Russian medical scientist and academician named Professor Konstantin Buteyko. His idea, or the Buteyko method idea, is based upon his research, which is that people who sustain the diseases of civilization, which we now call chronic disease, that these people all chronically or habitually hyperventilate. The term hyperventilation is normally reserved for acute hyperventilation. If somebody has been traumatized, or they're shocked, or they are perhaps some environmental issue and their breathing becomes very rapid and deep, and people call that hyperventilation. But hyperventilation is comprised of two words, hyper and ventilation. Hyper simply means too much, and ventilation expresses to ventilate, to breathe, in other words. So hyperventilation is just breathing above the recommended norm. And the recommended norm, according to medical textbooks, is around 3 to 4 liters a minute. And if you breathe above that amount, if you breathe 6, 8, 10, 12, or 15, or whatever liters per minute, according to Western medical physiology, you hyperventilate. And the respiratory center, which regulates our breathing, becomes accustomed to this. The whole organism develops some homeostasis around this, some defense and compensation mechanisms, many of which are we call diseases. But there are congenital diseases, there are infectious diseases, and there are the diseases of civilization. These days, once again, we call them chronic disease. And these diseases number around 200. Asthma, allergies, angina, bronchitis, bronchoecstasis, cystic fibrosis, diabetes mellitus, emphysema, hormonal disorders, so-called COPD, chronic obstructive pulmonary disease, there's fibromyalgia, there's a whole range of hormonal disorders. They number a dozen or so themselves, from Graves' disease to thyroid problems and so forth. And it's not so much, these diseases are not all brought about just because we breathe too much. It's because if we breathe above what is recommended, the organism's level of CO2 drops off. The proper level of CO2 in the indigenous levels of CO2 is diluted. And because CO2, or carbon dioxide, is so important to the regulation of the organism, CO2 in the blood, carbonic acid, determines the rate at which oxygen is taken off and delivered into cells and tissue. CO2 determines the aperture of all vessels. So if there's a deficiency of CO2, vessels will have the tendency to constrict. The the rate at which the antibody bonds to the antigen, in other words, the immune system, is regulated by the level of CO2. The threshold of excitability of the nervous system is regulated by the level of CO2. So a deficiency of CO2 will mean a heightened nervous response to our environment or stimuli. Even the functions of the brain are regulated by the level of CO2. The rate of, or the synchronicity of neurons synapsing with brain cells is linear to the level of carbon dioxide. Carbon dioxide is an essential ingredient for all biological organic life. So a deficiency of carbon dioxide produces a cascade of disasters for the mind-body mechanism. So it was Professor Buteyko's discovery that these people who suffer with this asthma, allergies, angina, bronchitis, high blood pressure, scoliosis, and so many other conditions, they number around 200 separate conditions, but within those conditions there are derivatives as well. So maybe, the way that medical science names diseases, they name them not according to cause, but either to their pathology or to derivatives of symptoms and so forth. So as a consequence, we have these several hundred and more chronic ailments, which very interestingly, and this should be noted by everybody. I forgot to welcome everybody, by the way, so welcome. But what should be noted about asthma, diabetes, emphysema, hormonal problems, COPD, obesity, schizophrenia, bipolar, and all these conditions, what should be noted about all this entire classification of diseases is the fact that modern mainstream medicine has no official explanation for them. So you ask the American Medical Association, the Australian Medical Association, or the British Medical Association, what is the official cause for asthma? They don't know. There is no official cause. It's a mystery. What is the official cause for diabetes? There is no answer. There is no known cause for diabetes mellitus. That's diabetes type 2. Diabetes type 1 is better understood because it usually implies that there's either the pancreas either doesn't function, it's dead, it's not there, or for whatever reason there's no production of insulin. Well, diabetes type 1 probably doesn't precisely fit into the diseases of civilization, although I guess there would be cases in which it would. So Professor Buteyko realized that his research showed that all these people have a deficiency of carbon dioxide, and the reason why breathing affects our level of carbon dioxide is because the level of CO2 in the air is around 0.035%, and the optimal level in the human organism should be around 6 to 7%, depending on where you measure it. In the alveoli, it's around 6.5%, but in the gall ducts and so forth, it should be higher. So we are supposed to have 200 times a greater concentration of CO2 in the human organism than in the air that we breathe. Are we okay?
No, it's not. Oh, we're back on.
So then we're having some technical things. Okay. So we should have around 7% in the human organism, and there's only 0.035% in the air that we breathe. Now, if if our environment contained, 5 or 6 or so percent of CO2 instead of 0.035%, it wouldn't matter how we breathed, because there would always be an ample amount of CO2, whether we breathe fast or slow or deep or shallow or whatever you like, because the environmental and indigenous amounts in the organism would be very close to each other, so we couldn't really develop much of a deficiency. But in view of the fact the level of CO2 in the environment is very low, 200 times less CO2 in our environment than what we need in our organism. Consequently, if we breathe above what's recommended, if we breathe more than we should, we will lose carbon dioxide. Now, the happy position with oxygen is quite the opposite, because with oxygen, we by volume within the organism, we require around 2%. But in the environment in which we live, there's around 20%. So it doesn't really matter how you breathe. Your organism will always be, blood will always be sufficiently oxygenated, because there's absolutely no shortage. There's so much of it. And of course, this is not the case with CO2. Not many people understand that. I could go a little further on the oxygen issue and explain that we're not really sensitive to oxygen. If I were to somehow, by some equipment or some magic or whatever, somehow remove the oxygen from the environment in which you are in presently, you would not begin to gasp for air and feel suffocation and feel the lack of oxygen or something. You wouldn't do that, because we are not particularly sensitive to oxygen. You might feel sleepy and tired, and most certainly if oxygen deficiency was sustained for long enough, you would even die. But you would not be automatically gasping for air to get more oxygen, because you just don't have that sensitivity to the stuff. If, however, I was to increase the level of CO2 in your environment by 1 or 2%, you would find yourself gasping for air, because your respiratory system is driven by CO2. The respiratory center, which is in the brain, the medulla part of the brain, it creates the feeling of air hunger, and it stimulates the feeling of air hunger, and the vagus nerve system, which is all around the lungs and so forth. It's going all right?
Mm-hmm.
Oh.
Very short 1 second drops.
Oh, I see. All right. Okay. The reason why you breathe, why you take breaths automatically, whether you're happy or sad or awake or asleep or conscious or semi-conscious, is because the respiratory center, located in the medulla oblongata, driven by the level of CO2, regulates your breathing accordingly. And it establishes a homeostasis within itself and within the organism. And so and this is why they're called the diseases of civilization. As man has become more civilized, these diseases, asthma, allergies, angina, diabetes, all these conditions increase according to our degree of civilization. Many centuries ago, the incidence of myocardial infarction, heart attack, bipolar, schizophrenia, asthma, allergies, bronchitis were extremely rare. For example, there was no known medically recorded, I'm sure there were, but at least there weren't really particularly any medically recorded incidents of heart attack. of myocardial infarction. And these days, I believe there are some 300,000 Americans alone having heart cardiac arrests and so forth. I think we only have to go back around 100 years to find that there were no, and this is medical journals, no recorded deaths from asthma. People had asthma. Asthma goes even back to Egyptian times, but there were no reported deaths. And it wasn't until the introduction of bronchodilating medications, which relieve symptoms, did the incidence of death by asthma begin to become statistically relevant, at least. So Buteyko claimed that by retraining our respiratory center and by normalizing our breathing pattern, we can reverse that category of the diseases of civilization and take them off. And I've been teaching this for around 20 years, how to do that. It's a job, it's work. It comprises of breath holding exercises and some lifestyle changes. And it took Buteyko some, I think, decades of work and research to develop a technique which one has to practice. It requires some supervision. There are quite often cleansing reactions and difficulties along the way, because it's not really a method on how to breathe, but how to retrain our respiratory center. Don't ever forget that you don't breathe 2 or 3 times a day. You breathe between 20 and 30,000 times a day. So if you try to change your breathing, you can change your breathing. As soon as you stop doing it, 5 minutes later, 10 minutes later, homeostasis will kick in and your breathing will revert back to normal again. So Professor Buteyko's concept, whilst he might set an ideal of how we should breathe, unless your respiratory center has been retrained, and it's quite a job. As I said earlier, I think I've trained over 20,000 students, and I think I'm under the impression I was the first Western Buteyko practitioner to be credentialed by Professor Buteyko. I can say, with very, very few exceptions that you can count on one hand, all my students found this quite difficult, and they had to put some work into it, and they had to practice, and they required a persistent guidance, particularly if their conditions were complicated and the way to unwind their condition was more complex. I think we have a couple of questions which I'll try to answer. Right. Yoki wrote, keep up the good work. I'll try. Thank you very much for your comment. I'm sorry about the echo. Oh, you think Skype's better? All right. Okay. I don't know, it's very surprising. My iPad is not so responsive. Okay. Okay. Yoki writes, how to find relief for bronchoectasis. Bronchoectasis is a condition whereby, as a defense mechanism against the loss of carbon dioxide, the bronchus and the glands around produce too much mucus, and the bronchus actually rots. You know, it actually deteriorates. But with the Buteyko method, and bronchoectasis is one of those conditions which require a practitioner to work with the student quite um, aggressively, quite persistently. You know, if the condition has just been diagnosed, just first been diagnosed, and you know that you've got a bit of a problem there, but you know it doesn't impact your life too much, then the condition can be very quickly, symptoms can be very quickly ameliorated. If the condition, however, is advanced and has been going on for a long time, still symptoms can be improved, and quite dramatically too. But it will take a week or so or more. But even within a few days, people notice there is some improvement. But believe it or not, and this is a principle of biology. This is not Buteyko's invention. This is biological principle. All organic tissue can be redeveloped. All organic tissue can be healed. If tissue is dead, that's it. You can't do anything. But even tissue which has been damaged, bronchioles, bronchus, lung tissue, kidney, whatever, if the level of CO2 is sufficient, it can be healed. It can be restored. Now, in the case of bronchoectasis, if your case is fairly mild or only has just been diagnosed, it's not much of a big deal. Within a week, you'll notice that you can walk further, you're less breathless, you feel better, you require less asthma sprays or whatever, and the mucus becomes less. Not necessarily by a huge amount, but instead of the condition continually deteriorating, it improves. If the condition is very advanced, it's a big job. It's a very big, long, hard job, and it takes months. So naturally, I hope that it's, in your case, it's just the beginning of this diagnosis. But either way, I would you will get significant, noticeable, incontrovertible help with Buteyko method in terms of symptoms and in terms of long-term restoration. I can't blame doctors, by the way, who would say to people with asthma, diabetes type 2, bronchoectasis and emphysema that your condition will deteriorate and get worse, multiple sclerosis, because they have seen this thousands and thousands of times, and they have only seen this. They haven't seen these conditions reverse. Therefore, they are trained that these conditions always deteriorate, and it doesn't help the fact that their help is by way of symptomatic medications which tend to produce some relief, but at the cost of deepening the disease. So I don't blame them for holding that view. They're probably quite honest. Indeed, they are when they say this is a condition that deteriorates and you can expect it only to get worse. But from a biological perspective, from the laws of biology, all tissue can be healed, providing it's alive. But the environment for that healing, for that reversal of disease, has to be in place. Now, if you're breathing 3, 4, 5, or 6 times more than you should, and if your level of carbon dioxide is much lower than what is what it needs to be, what it should be, of course, then the healing process doesn't happen, and naturally you will deteriorate. Some more. Kathy, hello Kathy. It writes. Kathy writes, "Can Buteyko method help with scoliosis?" Yeah. You see, Kathy makes a very good point, because like most people, Kathy might think that breathing and asthma makes sense, breathing disease, breathing method, uh, block nose, allergies, snoring, it all makes sense. But for something like scoliosis, which seems architectural, or hormonal disorders, or high blood pressure, or so many other conditions, how would you link them to breathing? Well, of course, there's no direct link between breathing and scoliosis, or any of these other diseases, except for the fact that the way that we breathe will determine our indigenous levels of carbon dioxide. So if, because you breathe above what is recommended in medical textbooks, you will lose carbon dioxide, the organism will be deficient in CO2, and as a consequence, a whole diverse and complex range of chronic diseases, according to our genetic predisposition, will defend and compensate against the loss of carbon dioxide. We've had so many cases, many hundreds of cases, of cholesterol being solved out with the Buteyko method. So how can you, breathing and cholesterol, come on, it seems ridiculous. But when you realize that most cholesterol doesn't come from diet, it's actually produced by the liver, and its objective is to prevent the loss of carbon dioxide. When it's looked at from that perspective, then the link is more obvious. And so it goes with so many conditions. I mean, asthma and breathing, there's an obvious relationship. But scoliosis is a typical defensive mechanism where the body tries to respond against hyperventilation and this curvature of the spine and so forth. I actually began working in the United States. It must have been around 15 years ago, I guess. And I worked with a chiropractor. And she brought her son to London because he had asthma. And the mum, the chiropractor, actually had scoliosis. And she was able to enormously improve her scoliosis. And the reason why she became a chiropractor was because she had scoliosis, and her life was made, reasonable and productive because of an excellent chiropractor, and that inspired her to become a chiropractor. But when she began practicing Buteyko method, it's not as though her scoliosis disappeared. It did not. But what happened was she needed many less, what do they call it? Manipulations or treatments, chiropractic treatments. So instead of going every fortnight or every week, she was able to survive by going every month, then once every 1.5 months, and then once every 2 months, and finally, she no longer needed to go on on such a regular basis. So, and because of her name was Dr. Linda Merkin, and because of her, I was introduced to other chiropractors who are familiar with scoliosis and the problems of that, and they began to appreciate how the breathing method has got something to do with scoliosis. But if you are cynical or doubtful as to how a breathing method could affect scoliosis, I would understand that you'd be cynical and doubtful. But if you look at it from a biological perspective on the indigenous levels of carbon dioxide within the human organism, then another another approach opens, the door opens to another view of the situation. Right. Oh yes, okay. Yeah, just a note to Yoki. that we have a workshop. I don't like promoting our workshops and things like that on these webinars. I try to just give information, but we do have a webinar starting on January the 20th. So you might want to either talk to myself or Martha, or send us a message, and we can more accurately explain what you might hope to achieve through this practice, what you can realistically expect. But I'm very pleased to hear that you were only recently diagnosed, so it's a good time. It's the most convenient time to learn this method and to do well with your practice and learn breath holding and reconditioning your breathing, changing the way that you breathe, so that this disease and this persistent production of mucus is stopped, so that your bronchus don't deteriorate the way they might otherwise. Right. So if there are any questions, I will please feel free to ask them, and I will try to answer them. This presentation was actually going to emphasize on children. I don't know if there are any mothers or fathers of children, but the point I wanted to make for children was that their treatment is much quicker. They get results much faster than adults, because well, you know, a newborn baby is literally full of carbon dioxide, and their breathing is very light and superficial when they're healthy. And as they go through the civilizing process of our contemporary environment, their breathing becomes deeper, they lose more CO2, and as they get older, of course, the indigenous levels of CO2 in the organism drop until they, you know, and then you can go from the maternity ward, where you will see life just delivered, and its breathing is light and superficial, so delicate, so refined, that if you look at a newborn baby, you can hardly see it breathe. In fact, quite often mothers become a little panicked because they think their baby has stopped, in actual fact. From there, you can go to the ward in the hospital for the terminally ill, where you will see people on their deathbeds or in critical care, lying on their back, mouth open, chest heaving, with a massive hyperventilation and so forth. If you properly make inquiry as to what happens during a heart attack or a stroke, they will invariably tell you that people become breathless. They become breathless first before an infarction. Usually these strokes and heart attacks and all this kind of trauma occur in the early hours of the morning, because the breathing gets deepest. And you can check this with any hospital. They will confirm what I'm saying. The A&E, or emergency ward, or casualty as they call it in Australia, is the busiest between the hours of 3 a.m. and 6 a.m. because when people are deeply unconscious, the breathing becomes the deepest. So you can see the relationship between breathing and trauma. Yeah. No questions? Okay. Yeah. Well, what should I talk about? Well, we can talk about the control pause, how you can check your breathing. The control pause is a measurement on how sensitive your respiratory center is. And all you have to do is take a normal breath in, a normal breath out, and hold your breath. Hold your breath by pinching your nose and keeping your mouth closed. And record how many seconds you can effortlessly hold your breath for. So you make a normal breath in, normal breath out, and hold. And then you record the number of seconds. and you shouldn't overhold because it's a measurement. You should only hold until the first difficulty, because we're trying to measure how sensitive your respiratory center is to CO2. If you can hold your breath effortlessly, easily, with no issue at all for around a minute, 60 seconds, it means you don't need Buteyko method. You don't have asthma, allergies, bronchoectasis, cystic fibrosis, diabetes. You don't have obesity. You don't have drops in sugar level. You don't have any heart condition. You're from the perspective of chronic disease, you'll be in perfect health. If you can only hold your breath for around 30 seconds effortlessly, it means you're not in any danger of trauma, but you will experience dragging health problems as you get older. And if your control pause is below 20, then you will have either immediately or in the future, you will develop one of several hundred chronic ailments, which are biological cause and effect of deficiency of CO2. If your control pause is 5 or 10 seconds, it's not sustainable, and you will have serious, very serious health issues. This is not, I don't mean to be negative. I don't mean to be positive either. I just try to be neutral in line with some, a very principled approach to chronic disease and how to reverse it. Oh yes. We are having another webinar in 8 hours time. So you're very welcome to join that webinar. And I think there's going to be more people. How many people do we have in this webinar?
5.
Only 5 people. You're only 5, but you're very welcome.
The next one will have 22.
Okay. So in 8 hours, I believe, we are holding another free webinar, so you can also attend that one. And in the meantime, you might go on our website, take a look at the testimonials, take a look at the idea, read about Professor Buteyko's ideas, and you may have some questions. You may, I would very much encourage you to not necessarily do one of our workshops. I'd be very happy if you were to honor us with doing one of our workshops. But more importantly, that you intellectually understand Professor Buteyko's idea. It's a huge and most important idea, and you will come to the understanding that this diverse range of chronic diseases, one doesn't have to have them, one doesn't have to put up with them, that you can take the symptoms off, that you can avoid this whole debilitating multiple sclerosis, this lupus, emphysema, asthma, bronchitis, bronchoectasis, cystic fibrosis, obesity, and these diseases, they all have no scientific official explanation by the Western medical model. But Professor Buteyko, a great Russian academician, made his discovery and developed his method. And from what I've seen over the past 20 years or so, and the results that we're able to consistently obtain we've added nothing to what he developed. I've brought nothing to this method except my repetition of it and what I was privileged to learn from my teachers. So I very much encourage you to investigate this idea and to read Professor Buteyko's literature and to look at the testimonials and to try to understand what this is about. And you may even choose to try an experiment a little by yourself. You may wish just to think about it for a while, whatever the case. But I would wish that every single person in this world understood the idea, and then from this understanding practiced it to some degree to see, is this effective, is this authentic or not. And what I've seen over the some decades, that everyone who practices, and some have to practice fairly hard to get a result. Some people have to put a solid, persistent effort with lots of coaching and lots of help and lots of encouragement and lots of advice and so forth along the way. But everyone who has managed to improve their control pause, everyone that has managed to improve their breathing, I can say their health, state of mind, the whole functioning of their organism always invariably, incontrovertibly, and without exception improves. So it's a good idea. It's a good thing to investigate. Okay. And thank you for coming again, Gigi. We've got another webinar in 8 hours' time, I believe. So if that's convenient for you, you'd be very welcome to come to that one. 7 hours' time, sorry, 7 hours' time. We have another, that's at 10 o'clock tonight, right? 6, 7, yeah, 7 hours' time. So you'd be very welcome to attend that also, if that's convenient for you. I think I'll wind up for now. I'm very grateful that you've taken your valuable time to attend this little presentation about Buteyko method. I hope that maybe, you give some thought to this idea and that you make some investigation. Obviously, we run workshops and we're always, more than happy to take in students and to teach them. But the most important thing, more important than enrolling in a workshop, more important is that you intellectually understand what this is about and why you might practice, because practicing this method is difficult. Practicing this method it takes some work, You have to concentrate, you have to do exercises 3 or 4 times a day. You have to attend these lectures to explain how to do breath holding and how to grow your breath holding and what lifestyle changes you need to make. And you have to invest not much money, but you do have to invest a good bit of your brain and a good bit of time into it. So, and a lot of the advice and the idea of the practice seems a little counterintuitive. And because of this and the work that you have to do, you have to be intellectually convinced to do it. Otherwise, it's hard to generate the willpower to do it. Belief is not required. Faith is not required. A positive attitude is not required. What is required is the work. What is required is persistent work with your attention and your efforts. And sometimes it goes very easily, and sometimes you have difficult times, but as your scores improve, you'll see a linear relationship. It's something like a bank account. The more money you deposit, that's a terrible analogy, banks, but anyway, you know what I mean. The more money you put in your bank, the more you have in the bank. It's that linear. The higher your control pause, the more robust you will be. The less symptoms you will have. The better you will feel. The more clear-headed and less asthma, less blood pressure, less fatigue, less, all these symptoms which have their genesis in a below or a less than optimal level of carbon dioxide. So I thank you very much again for taking the time out to join us in this little presentation. I look forward to hopefully seeing you at the next presentation in roughly 7 hours. Or otherwise, if you have any questions or queries, or you'd like myself or one of our practitioners to contact you and to answer specific questions about your condition, please feel free to be in touch. Thank you very much.